Hi, I'm John Stevens. I'm Chair of the Academy for Healthcare Science, and I'm here to introduce the shortlist for the Academy for Healthcare Science Award for inspiring the healthcare science workforce of the future. The shortlist is Transfusion Laboratory Services, Manchester University NHS Foundation Trust, Dr. James Willis, leading endocardiography and an HSST trainee from the Royal United Hospitals Bath NHS Foundation Trust, and Global Clinical Engineering Day team, NHS Trusts in the UK. Let's hear more about them.
As a newly qualified BMS, I attended a military presentation at Congress talking about collection of blood donations in the field and getting the blood as close to the patient as possible using golden hour technology. It was a million miles from our transfusion service and I was in awe. That stayed with me over the years and is what has inspired this project. In the peak of the global pandemic, our transfusion team were asked to look at emergency blood provision options for the Nightingale Hospital Northwest. We looked at several options and decided that the quickest, most cost-effective and safe option was to utilise golden hour technology. The staff at the Nightingale Hospital were a mixture of Army personnel and NHS staff from hospitals all over the country. They had varying training and experience with blood transfusion, and this is where we got creative. We needed blood provision in a box. Our CREDA queues contained everything that you would need to carry out blood transfusion and covered several eventualities. It contained emergency OD negative unit, a giving set, prescription chart, advice on setting up the transfusion, guidance on traceability, transfusion reactions, and transfer of the queue. To ensure the box was safe and that we met our regulatory duties, emergency units were also temperature monitored and tamper seals were attached. It was truly blood provision in a box. I nominated our team as the way they pulled together to deliver this project in 12 days in the peak of a global pandemic was exceptional. It was a multi-team, multi-site effort and it was tough and a big ask, but this did not faze them as they put the patient at the forefront of everything they do. Our team inspires me. I hope they inspire you too. Thank you, Academy for Healthcare Science, for giving us this chance to reflect on the achievement and the opportunity to use this platform to hopefully inspire the next generation of scientists.
I've nominated Dr. James Willis for the Inspiring Healthcare Science Workforce of the Future Award. James now is our HSST trainee and also lead echocardiographer here at the Royal in Bath. James has pushed the academic boundaries to the maximum since his career began. He gained a PhD from studying the right ventricle both locally and internationally. In addition to our full-time post, for 7 years he was senior lecturer in healthcare science, training the cardiology workforce of the future. James not only clinically aspires to the highest level, but teaches all the technical and medical team. He always humbly has significant numbers of staff following in his footsteps, stepping out for further learning. I nominate James as an individual with unique qualities which deserve recognition. This has not been one project but a 15-year process of continued published research and guidelines. I have observed throughout an entourage of juniors passionately developing under his leadership. This has been aspirational throughout as James aims for a future consultancy post in healthcare science.
Hi everyone, I'm Vaish, a healthcare scientist specialized in clinical engineering. The project we are nominated is the 2020 UK celebration of Global Clinical Engineering Day. This was done through a professional video and an extensive communications campaign. The video highlights the important work of clinical engineering teams in response to COVID-19. 31 clinical engineers from across the UK and some senior leaders from NHS England and Improvement took part in this film. The video has so far been watched more than 4,000 times, which is 11 times more than the numbers of 2017 and 18. The total impact or impressions of the social media campaign has reached more than 65,000. The film has been appreciated locally as well as internationally, and as a result, many of our clinical engineering colleagues have been invited to trust boards to talk about their work. A journal article also been published in the Academy for Healthcare Sciences Leadership Journal. Now you will see some snippets of the video to appreciate the quality of the film. You can also watch the whole 1 hour film on YouTube. Just search for keywords Global CE Day and you will find us on the top. Thank you.
The judges thought the Winners project was unusual and outstanding, a highly innovative initiative which was wide-reaching both inside and outside their immediate field. And the winner is the Global Clinical Engineering Day team, NHS Trust in the UK. Congratulations.